Now, let's get to the technology. So you're doing a CEREC there. What's your favorite part of the last few years about the technology advancements in dentistry? Obviously CEREC, but what else?
Yeah, CEREC was one of them. I think cone beam, so the x-rays or CBTC scanning. When you're doing an implant case, I'm very fortunate. I get to work with specialists. The clinician that I get to collaborate for the last 13 years with, Dr. John Shea, he was a big fan of implants and always developing his dental assistants on the latest technology. So now you get to be a part of that journey and see how it's, implanted, integrates, and you go to the finished result. So I'm a big fan of implants, Steve, hands down, but I think something else with technology, which I just became certified in, so thank you to you guys and your team, but it's Epic. Learning a new charting system and bringing in and collaborating now with healthcare professionals at Kaiser and seeing a whole medical history from a patient and being able to now have a conversation with our clinicians on what does this look like when this patient's coming in for dentistry.
So talk about that. What gets you excited about it's basically to a lot of people, they think it's just a new practice management system, kind of a big database, right? But it's way, way more than that. You and I both know that. What gets you excited about that as a dental assistant? Expand on that a little bit more.
And I have a question for you, Steve, that's been asked of me quite a bit when it comes to this. The mouth-body connection is, we're big advocates of that. And one thing I'm learning with Epic is you get this maybe laundry list of information from the healthcare. Not everything's going to transfer over. You don't need everything to transfer over, things that are relevant. But when we're talking about the mouth-body connection, how as dental assistants can we support our clinicians with that? What is our role?
So much. Okay, so here's a practical answer to that. We know what happens when after the dentist does their diagnosis, or we can even go to hygienist, okay, but mostly the dentist does their diagnosis, and when they leave the room, right, we coach dental assistants to stay in the room once the doc leaves, right? Okay, there's a reason for that. What does the patient do?
They turn to us and ask.
Yeah, they turn to you and ask questions. So we know that happens. So you can support the mouth-body connection and the oral systemic link by being educated on the subjects, right? Whether it's brain health or vascular health or mental health, so that you can talk to the patients about how the mouth is the gateway to the health of the rest of the body, and you can engage with that patient right there. So the education is a key component of it.
Where is one resource, Steve, if a dental assistant can go to find an article or has that ongoing education, especially for mouth body, that you would recommend?
So we, for us in our network, we have a bunch right online in our system. But I'll tell you what, there is so much out there right now. There's not just one place. You can just Google it and you'll find it, or YouTube it, and it is there. And there's a plethora of information. You can also, we're working on building up Smile Generation, the information under Smile Generation, but we also have it on our office websites. It's all over. Walk into one of our new offices, our next gen offices that we're just starting to begin building, and you can just pick up the flyers right there.
I heard one of our Nevada offices has a whole wall, like a virtual interactive wall with mouth-body connection, with CEREC. So I know that's going to be, when it gets here in California and across the country, it's going to be exciting for our patients to be able to interact live with the wall. It's like moving and active with that.
Right. And what happened was, is the year 2000, the U.S. Surgeon General said, look, we cannot have good overall health if we don't have good oral health. And that began a process back in 2000 of science and looking at the science and the data of the oral health, whether it's the bacteria, periodontal bacteria, or just decay, perioabscesses, endoabscesses, implants, you mentioned implants, all those things, and how they affect the overall health of the patient. And the amount of science and research and data that's happened in the last, we'll say mostly 10 years, last 10 years, it's unreal. It's absolutely unreal. You connect the dots. We have a lot of great bacteria in our mouth, but we have a lot of bad bacteria that have been proven to cause atherosclerosis and heart disease and other problems. They've now identified the actual bacteria that causes dementia and ultimately leading to Alzheimer's. They've definitely correlated to preterm births. So especially for women in the early stages of pregnancy to get their teeth cleaned. They've even recently found that it has lowering the bacteria levels in the mouth. If you have high levels of bad bacteria, that it can lessen the severity of the coronavirus if you get it.
There you go.
Great paper out right there. Dental assistants want to research it by Dr. Victoria Sampson out of England. You can find it online. If not, text Rose or email Rose. We'll make sure you get a copy of it.
You can DM me, dental assistants.
Yeah,
you know I
we'll
respond.
get it to you. But yeah, it's just super powerful. And what we're also seeing is the dental medical integration happening with the larger carriers, understanding that they need to provide benefits for patients, not only on the medical side, the dental side. So all of that is starting to come together. It's a little bit slower than we all want because dentists work in a different coding system. But even that is starting to change, right? You guys learned the CDT codes probably in dental school. Well, the medical profession works on ICD, I think 10 now. And so we have to cross code and learn all that, but all that's happening right now.
Wow. I mean, so much has changed even from when I started. I mean, that was in one of your offices in Rancho Cucamonga with Dr. Carolyn Gazal. And I remember some of the technology we were working with back then, it was like a wheelhouse, not moving. And now to see where we've gone with our charting system and where we're going, it's very exciting. Yeah. We as dental assistants get to be a part of that change. I'm now talking to my nurses, MAs, and they're like, Rose, we've been on that. I was like, well, guess what? We're one of the first. I think that's what's so exciting when I'm working with my peers as dental assistants. They're like, epic, Rose, what is that? I was like, let me tell you, it's really epic.
It is. Yeah, I tell people it's like going from driving a Honda Civic to a Ferrari or a Maserati. It's just that much more powerful. And that's what we're experiencing. And we're only in the beginning stages, Rose. You know, we just started a couple months ago, but we're in process. We'll have 100 offices on it by the end of the year. By the end of next year, we hope to have 700 offices on it. So it's just going to absolutely explode. I really believe dentistry is at the beginning of a new technology boom. And so what an epic time, excuse the pun, epic time for people to get involved as dental assistants.